So in the UK, they are currently running in about 200 organisations. Most of them are hospital trusts, and most of the hospital trusts are acute trusts. About 20% are hospices, and there are some few other organisations running rounds as well, all over Great Britain. And they obviously run in America as well, in about 400 organisations in America. Well, they are still being newly implemented in various organisations. One of our key research findings was about sustainability, and one of the key features around rounds is that they require a huge amount of input from the staff that run them in terms of their time and emotional resources. So particularly the facilitators have a lot to do to kind of find people who might be able to tell their stories, to help them prepare to tell their stories, and to support them to tell their stories, and to keep the safe space when the round is actually held. And so what we found in lots of organisations was that all the responsibility for rounds being successful and for running was falling on the shoulders of maybe one or two people. And so we've recommended that they make sure they use their steering groups, and that they think about a team of facilitators that can share the burden. They make sure they have administrative support, because some sites didn't have that. So we've translated our findings into two main outputs as well as the traditional academic outputs. We've produced a film which aims to show people who've never been to a round before what a round might feel like, and to share our findings. We've also produced an organisational guide which translates our findings into more practical recommendations for things that organisations might do to help them to implement better and to sustain rounds. And they're both available on www.surrey.ac.uk/Schwartz evaluation.